Thank you for the applause, and thank you, Leslie, for exposing the fact you notice which minister gets the graveyard shift this afternoon. I too am delighted to be here when officials had briefed me on the collaborative event that was being organised. I thought I would really like to be part of this to emphasise local government's role, but also because I believe through personal conviction how important this agenda is to Scotland. But just picture the scene back at Kirklandnewt Primary School in Renfrew at 3 o'clock if I'm not there to pick up my kids. As a teacher says, don't worry, your father is lecturing others on good childcare and early intervention, and that's why he can't come and collect you from school. So that's why I'll leave, and rather than stay for the collaborative element, I think the most important element of today's conference, which is where you share ideas and focus on the challenges and opportunities ahead. And I think that's the way we should consider this conference and this event. By working together, by collaborating to focus on outcomes is absolutely what we should be doing collectively. So 3 reasons, as I say, I wanted to be here: my personal experience, the importance of community planning, and the role of local government. And there are many representatives from local government here who could speak far more eloquently than I on the difference that proper interventions can make. But I suppose our joint aim in this is best exemplified through the national outcome: every child has the best start in life and is ready to succeed, a core belief of the Scottish Government. So local government having a key role, community planning I'll cover. And I want to just say a wee bit about my personal experience before being a government minister and participating in the way that I am. I was quite heavily influenced by the Director of Public Health in Greater Glasgow and Clyde, and also the local health improvement workers within NHS. Within my CHP role, my health board role, I was a non-executive director and a council leader. And I would never let boundaries get in the way of doing things that I felt could make a difference, especially if we had evidence that it could make a difference. Now, some examples of that would be the Triple Pre programme, where I was convinced that sometimes a universal approach is necessary, and within that, targeting both universality and targeting those in the greatest need can go hand in hand. And I was convinced that we needed such a scheme in Renfrewshire, where I was council leader, and both health and council worked together to ensure we were part of that expanding programme. So too there were policy choices. So in healthy living, we were challenged. Why is it that we've got healthy programmes, education in schools, but we let our kids walk 10, 20, 30 yards to the nearest chip van to go and make a completely different choice? And if we wanted to be bold and radical around that, and I mean primary schools, not just the secondaries, they would need to make different choices as politicians. So we took the radical step of banning chip vans within 500 metres of primary and secondary school gates. So that's just some policy choices. And when it came to expanding both smaller class sizes and free school meals, we targeted it in a way that could make the biggest difference within limited resources. So I have firmly believed for some time that early intervention does make a difference, that prevention is the best way to deliver support, and getting it right in the early years is the only way to go, and we can make the biggest difference. Not just because it's morally right, but because it will make an economic difference too in these tight financial times, where we know that for every £1 we spend in the early years on the right interventions can save £9 for the rest of a young person's life. But why collaboration? Well, because it goes beyond, as this conference shows, goes beyond direct early years services, beyond traditional service boundaries, and it focuses on improvement together. That is collaborative working, and so too that is community planning. Key partners, not just in traditional early years, but thinking beyond that in terms of housing, transport, planning, sport and leisure, about working together. We know there's good examples out there. Let's upscale that to a national level, providing the toolkit, providing the evidence-based programmes, recognising sometimes it will be targeting, sometimes it will be universality, but teams working together and a bit of healthy competition between and within groups is no bad thing to ensure that we can deliver the best we possibly can. Now, I was honoured to lead the Community Plan Partnership review with the then President of COSLA, Pat Waters, and we produced a range of recommendations to ensure that future CPPs are more successful. And I know we are in tough, challenging financial times, but there are new resources in this area. And I do sense from this conference and from other places a window of opportunity in which we can deliver. Now, in practical terms, we can use our current mechanisms to make this happen. All of you will have, for example, integrated children's service plans and partnerships and mechanisms for delivering them. We can apply improvement science principles to those processes and mechanisms to refine and improve their work, and that is what we must do. We can appropriately reflect and refine them within the community plans and the single outcome agreements. But let's be realistic, the community plan arrangements we've had in place so far haven't delivered as much as we would have wanted. They haven't gone far enough in bringing together every part of the public sector and the third sector and others to truly deliver at a local level, and that must change, and that's what the statement of ambition should do. But I can't help but reflect, sometimes we become overly negative about silo mentalities. Now, we must break away from the departmentalism and the silo mentalities and the divisionalism that sometimes we feel as if exists. But when I was describing community planning and single outcome agreements to the South Australian Minister for Local Government, he just couldn't believe that we were all signed up to the same agenda, we had shared priorities, and we were willing to work across boundaries. So please reflect on the positive as well. We're trying to dispense with the departmentalism. That's hence this collaborative approach. But we're doing much better than sometimes maybe we get credit for. But that statement of ambition will drive that joint working and that clear vision, which I know the Permanent Secretary referred to earlier, and how we're responding to the Christie Commission by way of the 4 pillars of reform, prevention, integration, workforce development, and improved performance. So how will community planning change? Well, first of all, there'll be a duty on all partners. And I want us to behave as if this legislation is already in place, because we intend to deliver the legislation on new community planning, which will place a duty on all public sector partners to have joint and equal responsibility to make it work, feel a sense of responsibility for each other's outcomes and targets and objectives, because we're all in the same team, and that's the kind of focus we want to deliver, a Team Scotland approach. But whatever legislation we provide, and Minister Campbell will do more in terms of children and young people in the bill that's progressing, but it's more than just legislation. It's the culture you create as public sector leaders. It's the practice you deliver. It's that can-do attitude of working across and within boundaries to make things happen that will make the greatest change. And we can't be too prescriptive in how that's done. We wouldn't want to be, but hopefully we can provide the resources and the toolkit to make it happen. And I see it happening through community planning. Delivering in the early years, because if we adopt this collaborative approach, we deliver it effectively, this could be the most advanced element of community planning that we have seen, and maybe we will ever see. A real focus on place, a real focus on people, and that real team approach, where you challenge progress, less emphasis on process, but you challenge progress. And I do recognise that people will need a degree of prescription and understanding of what's expected of them, and we will have monitoring arrangements and a review of how we evaluate community planning, but it's not to add more process to the system, it's just to ensure we focus on what really matters, and a prevention plan will be at the heart of future community planning. There will be a new national group. It is led by Pat Waters in his new role. It will provide national oversight and guidance and support. It pulls together every part of the public sector. Quite surprising that we haven't had a national organisation, a national meeting around community planning, considering how important we've said that it was, but we will now have that national community planning oversight group. But it's not about being top-down prescriptive. I hope the sense of the conference and the collaborative is it's your solutions locally that will make the difference. It's whatever works for you locally, what your evidence is, what your needs are, what your best resources it can deliver is a matter for you. But there will be new single outcome agreements, new guidance to support them in place for next year, with a clear focus on early years, because I say again, we know it could make the biggest difference. So we very much look forward to seeing the progress we can make and hearing how you have made the lives of our children, our families and our communities better, because we know we can do it, and these difficult financial times, but the opportunity is there. Let's grasp it. Thank you very much.